Did that test with freezing, putting freezing material on the tooth, and I almost jumped out of my seat.
Yeah, well, that means that the nerve is alive. If you put, I remember as a kid biting into an ice cream cone, and good grief, I think I did the Olympic record for the standing high jump.
So we called an endodontist that they work with, and the endodontist said, I want to see you, come in here. And they were trying to prepare me for a root canal that day. I said, absolutely not. But the anomaly of the tooth being, quote, vital, the nerve being vital, but they still were pretty much ready to do a root canal.
Well, there's a friend of mine who had his root canals removed, and he was, his brain wasn't working too well. He was head of the largest invasion the Air Force had ever done in Vietnam. He was the head man there, so he's pretty smart. And he could smile a lot, but he couldn't really carry on a conversation. Well, we got, I think it was 5 root canals out of him, and, there's a large service club here called Rotary, and he became the managing director, or whatever they call it, of that club, which is a huge responsibility, and he had lots and lots of things to keep on his mind, and he just had a tremendous personality. None of this did I see when I first met him. And so, there's a total change in him. Now, when he had the teeth removed, he had temporary bridges put in. Well, he called me one day and he says, this tooth's a little sensitive up here. And I said, okay, close very, very slowly and tell me where the first place is it touches. He said, well, right there on that tooth. Well, the tooth was getting the force of the bite on one tooth instead of spread around. So I called a friend of mine and I said, can you just kind of go on the temporary, and I think his bite will be fine. He says, yeah, I know what you're talking about. That's fine. So he called for an appointment, and the secretary said, well, what do you need to come in for? Well, I've got a sensitive tooth, and I think it just needs a bite adjustment. No, you need a root canal. I'll go ahead and schedule you for a root canal. And I am hearing this, maybe not every day, but darn close to it, where people are doing root canals just because you would think they had a quota. Well, sounds like maybe they do. They're trying to save teeth. But what they don't realize is that in the studies we've done in the last 3 or 4 years, we have found 28 different bacteria in root canal teeth that are associated with heart disease. We have found about 23 associated with neurological diseases. And going back to the 17-year-old, okay, here's what he's got to look forward to, because that's close to the break-even point. 18 years is the break-even point. With a male, if you do a root canal on one of the 4 front teeth at age 18 or below, the testicle on that size shrinks to half the size of the other one.
Some people listening to this are not going to believe you.
Well, I really don't care. What I'm doing is putting the information out there, and there are people who don't care that alcohol creates a problem, that smoking creates a problem, and I don't care. It is your personal decision. But I think people have a right to know that if, take females, the tooth next to the front tooth, the number 2 from the center, you do a root canal on that, and I don't have a figure, because this is not something I ask every woman that walks by, but they lose their ability to have a sexual climax. And if you do all the procedures proper in taking the tooth out, that can come back again. Well, we shouldn't be having sex anyway. But some people think you should. Is this something that is significant? If it's you, it is significant.
Are you also looking at the body meridians? Do you have acupuncture stuff involved in your protocol or in your thought process with this? Are you dealing?
Well, you're right on half of it.
Okay.
In their procedures, but in my thought processes, yes. Because somebody brought this up to me years ago, that breast cancer happens when you got root canals on the bicuspids, on the bicuspid meridian. Well, what's a meridian? Well, it's this invisible electric wire that runs through the teeth and the rest of the body. Yeah, sure. And as I begin to study root canals and kind of isolate them into heart disease and breast cancer and MS and ALS and so on, it became very obvious that for a guess, it's pretty good that most women who have, working backwards, most women who have breast cancer have root canals or have had root canals on their bicuspids. And you start looking at it, and even though there are 4 different techniques of figuring out what the meridians are attached to, it's become very obvious that they're attached to something. And all 4 of them do agree that the reproductive system is attached to the 4 front teeth, upper and lower. So we've worked with cases of sterility. I've got 53 couples who have children now who were sterile beforehand. And root canals are part of that problem.
Can you go back to the 18-year-old and what are the ramifications of those root canals? You started one with the first point. Go ahead.
This is something somebody asked me about. A patient asked me, and I said, well, I didn't know anything about it, but this was, we're talking back in the 1980s. Then I started asking men. And, some of them had that problem and some of them didn't. And it pretty soon became evident that age 18 was the time. Now, there are men who have had root canals on both front teeth who have still fathered children. So it doesn't necessarily mean sterility, although the sterility in high school seniors, in a publication that came out not too long ago, was close to 20%. Well, there's more to it than just root canals, but root canals are something that I feel you should know about. You have a right to be exposed to it. Whether you believe it or not really doesn't matter, but by the time you've heard it 4, 5, 6 times, and by the time it happens to you, then you believe it. I have had physicians and dentists who criticized me 30 and 40 years ago, criticized me very heavily. Then what do you think happens when there's some disaster in the family or in them and the medical profession can't handle it?
They become receptive.
They come to me. And then they become, quote, believers.
So you're the dentist of last resort. Simply because they have tried everything else.
Yeah. When you've tried everything else and it doesn't work and you decide you don't want to die, then that's... I used to kid about the patients that I saw had seen 32 doctors before they got to me. Well, if you've had a heart attack, you're not going to have to go to 32 doctors to find that out. If you have a broken leg, the first doctor or two is going to figure that out. But if nobody can figure it out, then look to the mouth, because the mercury is poisonous to any cell that it touches, and the root canals, the ones that we have done, root canals and cavitations, we've done about 500 now, and we find 100% of those areas are contaminated.
You know what? There's a myth going around in dentistry, traditional dentistry, that when you first get your mercury amalgams, everything is very dangerous and at risk. But as time goes on, you're at less of a risk. That's what a dentist told me, that it wears off.
Well, I hadn't noticed that, because the amount of mercury coming out of the filling continues. When all the mercury's gone, it turns to sand and falls out. But it's slowing down? No. We have not seen evidence of this, and we have instruments that will measure the amount of mercury coming out of fillings. And we have measured fillings that were like 20 years old and find they have 5% of the mercury left. Well, what happened to the other 95%? It went all over the body. Now, Weston Price did some work with Mayo's. Maybe you've heard of the Mayo's Clinic?
Of course.
Well, Mayo's has pretty decent reputation. And working together, they found that they could take a root tip from somebody who had a disease and had a root canal. They take the root canal tooth out, take that root tip and plant it under the skin of a rabbit, and within a few weeks the rabbit develops that disease, and in particular with heart disease, it could be transferred 100% of the time. That what they would do is take out the tooth, take off the root tip, stick it under the skin, and in approximately 2 weeks the rabbit would die of a heart attack. Then they would take it out of the dead rabbit, put it into another rabbit, and in approximately 2 weeks it would die of a heart attack. And they would do this for 30 rabbits. And they found that heart disease was transferable 100% of the time, and the ones that didn't transfer very often still transferred 88% of the time. And they did this study on 60,000 rabbits. My take on that story is that they were working in Cleveland, Ohio. And because of prices works, that's why they have